what are the symptoms of coronavirus?
All right, so the main ones that you hear from the CDC are fever, shortness of breath, and dry cough. So fever, first of all, please realize that your body varies its temperature throughout the day. So most of us do not have that perfect 98.6 temperature all day. Take the thermometer that you would be using if you were ill and measure your temperature in the morning, at midday, in the afternoon, and in the evening. And do that for a couple of days, maybe 3 days, and see how much you fluctuate. You'll know if you're outside your normal range. Also of note, most viruses like coronavirus tend to make your body fever in the afternoon. So really be alert if you see your temperature go up in the afternoon and stay up throughout the evening. Shortness of breath feels like a tightness on your sternum, like on your breastbone. And you can tell that the inside of your lungs are inflamed. You don't mistake it. You know something is going on deep down in the lungs. As it becomes more severe, there's actual pain in that breastbone. It's not just sore. It's when you breathe in, you feel pain. And so you're not getting enough oxygen in. So you're going to start seeing your fingernails turn blue. You're going to start seeing the edges of your lips turn blue. If you notice that happening to someone you're caring for or for yourself, you need to call the doctor. You need to call emergency. If it goes on for very long and you haven't gotten help, you need to call 911. And then the dry cough. So a lot of people are mistaking a dry cough as something that does not produce anything. And that is not necessarily true. People with a cough, with the COVID infection, 30% of the time actually are producing some sputum, some gunk from out of their lungs that the COVID is having your immune system produce. So don't think that you're not necessarily producing anything with a dry cough. The dry cough is called that because it's down deep from inside the lungs. It's not that tickly, snotty cough that you get in your throat with basic colds. It's coming from somewhere else, and some of the coughs do not produce anything. So please recognize that sort of subtlety in dry coughs. Another rare, in some areas, symptom is anosmia, or I can't smell. And this is really interesting. At first, doctors and scientists were sort of disregarding it, but we're noticing in the United States in Google data searches before big explosions in New York, Louisiana, Michigan, that there were several more searches on the internet for I can't smell. So again, if you notice that you can't smell oranges or lemons or things that have a very fragrant odor, you might want to pay attention to yourself over the next few days to see if you develop any of those other symptoms that I mentioned earlier. If you notice that the person you're caring for that is infected has sudden confusion when they wake up in the morning, or it's very difficult to wake them up, this is another sign of a lack of oxygen. Seeing in about 33% of cases that people are experiencing diarrhea. And another symptom that's showing up in just a small percentage, maybe 4% of patients, is the co-occurrence of pink eye or conjunctivitis in the eye. I wouldn't worry about it if you get pink eye to think that you have COVID. Probably not. But if you have some of these other symptoms, that combination, call your doctor.
For some of us that might be paranoid or obsessed, where we're like, oh, well, I always have those symptoms, or I have one or two of, or how can we avoid freaking out?
A lot of us are going through seasonal allergies right now, especially asthmatics and things like that. And so we do have a sensation of difficulty breathing in our chest, or we are having a runny nose. Maybe our eyes are irritated. We do have a headache. Try not to conflate those with other more severe symptoms. Extreme fatigue is definitely a symptom. And in people recovering, they're noticing that that's going on for weeks and weeks. So be prepared if you do get COVID that you might be out for a while.